Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
This is part 2 of our stress. On part 1, we did describe how stress actually causes all the disease entities in a very good metabolic and biochemical explanation. I suggest that you review that in detail so you understand for your patients why stress is such a killer. We say that, but can we also understand that? Watching part 1 will help you do that. To objectively assess stress biochemical impact, we need to do some tests. Saliva cortisol is one of them. It measures free levels of cortisol. You do it multiple points in time, morning, noon, evening, and night. It works because saliva reflects the unbound bioactive cortisol and bypasses the serum proteins. And there is diurnal rhythms to this. Elevated evening levels or flattened curves will signal the HPA axis dysregulation. Chronic stress often presents as hypercortisolemia or in burnout, hypocortisolemia, and it correlates with fatigue, insomnia, or metabolic dysfunction. You can also do serum ACTH and cortisol paired, the levels ideally with a dexamethasone suppression test. Well, what it will do, the ACTH drives cortisol production, and failure to suppress the cortisol post-dexamethasone indicates HPA axis hyperactivity. Elevated baseline suggests chronic stress. And this will identify cushingoid states, subclinical adrenal overdrive, and of course, stress-related metabolic disease. You can also get blood catecholamine levels like norepinephrine and epinephrine. A plasma or 24-hour urine catecholamine and their metabolites is an important test. They're called the metanephrines. Chronic sympathetic nervous system activation is going to activate and increase these markers. It will correlate with high blood pressure, arrhythmias, anxiety, 8-hydroxydeguanosine, which is, of course, a oxidative stress marker that eventually leads to DNA adduction and damage. You can also do inflammatory markers in the blood to look for high sensitivity, especially C-reactive protein, IL-6, and tumor necrosis factor. It will show us about this systemic inflammation that chronic stress can lead to. And they're a red flag for diabetes, depression, and tangible pathology for you to work on. And obviously the simple cardiometabolic profile, glucose, hemoglobin A1C, triglycerides, they will help because cortisol, catecholamines disrupt glucose and lipid metabolism. And it will reveal insulin resistance or dyslipidemia as precursors to the metabolic syndrome. And these oxidative markers I was talking about, like 8-hydroxydeguanosine and malondialdehyde, are important parts and components of our practice. They will look for reactive oxygen species from catecholamine excess. And that's important to have because the links to cellular aging, chronic disease like cancer and neurodegeneration will be part of it. And there's one other that probably you've never heard of, and that's hair cortisol analysis, which is basically a cumulative cortisol level over weeks to month. And because hair traps cortisol, and it will demonstrate chronicity of stress, and it correlates to this systemic effects like obesity or PTSD. Now, a multimodal approach is ideal. Start with saliva cortisol to map diurnal panels. Get C-reactive protein, CMP. If you suspect sympathetic nervous system overdrive, get an autonomic nervous test done and or urinary catecholamines. For long-term trends, you may consider hair cortisol. And these tests interpreted in context with your patient's history, symptoms, lifestyle, they're going to paint a precise picture of stress, biochemical toll, and will guide your interventions and what you need to do. It's important. 37 billion reactions per second in our bodies is what we are contending to. Stress doesn't nudge the system. It rewires it.